Hello, it gives me great pleasure to open this conference with a presentation on cell therapy then, now, and tomorrow. But firstly, the history of cell and gene therapy. Because of the limits of time, I can only do this presentation from a macro view from 50,000 feet, just like this view of Singapore. So please excuse me for not mentioning the names and details of everyone. But firstly, let's talk about bad cells. In fact, when cells become bad, they become tumors. And the ancient Egyptians first described this concept in about 3000 BC. But it was Hippocrates who first coined the term carcinoma to describe the crab carcinos that adheres to its surroundings with its claws like tumor. In Singapore, we have many new treatments against cancer, but for the crab, we've found a way to defeat it, and that is with the chili crab. But before we use cells to treat cancer, the first use of cells is probably red blood cell transfusions. In 1665, with the first dog-to-dog transfusions. In 1667, from lambs to humans. And then 1818, where the first successful human-to-human blood transfusions saved a life. But the concept of cells themselves, the term cells, was probably described by Robert Hooke. When he improved on the microscope, he found in tissues these spaces, small little spaces in between, and called these cells. This was later understood to be life structures, cells, that and the concept was really improved upon in subsequent years, and really I think the beginning of cell therapy. Gene therapy probably began with the discovery of DNA, and this spanned between 1869, when nucleic acid was first discovered, all the way until 1953, when the structure of DNA was discovered by Watson, Crick, and Franklin. The first use of the term cellular therapy probably began with Paul Nijhuis, and from 1931 he treated more than 12,000 patients with animal cells, injecting them in the muscles of humans, including Pope Pius. The benefit was uncertain, and there were several instances of adverse reactions, and the American Cancer Society had to come out to say that there's no evidence of benefit at the time. But the real dawn of modern cell therapy probably began with atomic bomb. Atomic bomb itself caused a disease called atomic bomb disease, where patients had bone marrow failure leading to infections, bleeding, and death. So scientists began to ask, can bone marrow infusions rescue people from otherwise fatal body irradiation? And in fact, if we give people body irradiation to treat their bone marrow disease, can we rescue them with a marrow infusion? This led to the successful work of people like Don Thomas, who performed the first successful bone marrow transplant in 1957, and with subsequent research improved upon it, leading to a Nobel Prize in 1990. Over the years, this field has been improved upon by understanding of the role of histocompatibility for hematopoietic stem cell transplant, the use of cord blood transplantation, and the use of half-match transplantations, otherwise known as haploidentical transplants. To date, nearly 2 million hematopoietic stem cell transplants have been performed, and the field really took off after the 1980s and 1990s, when the scientific improvements really improved the survival of patients in this field. Some of our other pioneers in cell immunotherapy include Saul Rosenberg, who pioneered the use of tumor-infiltrating lymphocytes in 1986. We have here today Ted Womack, who together with Mark Davis discovered the T-cell receptor in 1984. And then there's Carl June and Michel Sadelain and many others who discovered the use of chimeric antigen receptor T-cell therapy. Some of our pioneers in gene therapy include Martin Klein, who unfortunately had a failed illegal study in the early years. However, Anderson, Blees, Calver, and De Silva had the first successful gene therapy for severe combined immunodeficiency. Jennifer Doudna and Emma Charpentier discovered and found the use of CRISPR for gene modification. And James Wilson had an initial failure with adeno-associated virus, but there are now many approved FDA therapies for this using AAV. Some of our pioneers in cellular regenerative medicine include James Thomson, who developed the use of embryonic stem cells, Shinya Yamanaka, who found a way to create induced pluripotent stem cells, and Anthony Atala, who developed lab-grown organs. So to our pioneers, thank you for revolutionizing the field of cell and gene therapy, and thank you for sharing with us your wisdom. So where do we currently stand in the field of cell and gene therapy? There are many FDA-approved cell therapies. And for cancer itself, you can see that there are a variety of CAR T cell therapies, as well as some other immunotherapies itself. The field really took off with CAR T cell therapies, and you can see this New York Times publication in 2012 of the first successful recipient of CAR T cells, and she continues to do well to date. In fact, global cancer cell therapy utilization has really taken off with CAR T cells leading the charge. And you can see that around the world, adoption has really taken off. FDA-approved gene therapies, you can see that there are a number of AAV-approved therapies, but there are also autologous gene-modified hematopoietic stem cells for a variety of indications. There are also FDA-approved regenerative cell therapies, and this field is really starting to take off with many approved cell therapies in future. These are just a series of FDA-approved cord blood banks, which are given a stamp of approval by the FDA to manufacture cord blood. But beyond these FDA-approved cell and gene therapies, there's a whole big world out there of cell therapy activity that's happening. From hospital-based point-of-care products in clinical trials to those in local regional contract manufacturing, as well as global industrialized manufacturing, all of which are breaking the frontiers of cell and gene therapy. So what is the future of cell and gene therapy? What does the crystal ball say? I like to use this Gartner hype hope cycle, which is usually used to describe technology innovations, where there's an initial trigger, inflated expectations, some disillusionment, followed by enlightenment and productivity. Stem cell gene therapy has been thought to go through this cycle where there's initial enthusiasm and then some disillusionment due to safety concerns, and then development of new technology like lentiviral technology, leading subsequently to clinical efficacy and then approval subsequently. But what's happening right now is that as cell therapy and gene therapy come together, this synthesis between these two technologies, for example, in CAR T cell therapy, we use cells with gene-modified cells itself, this is leading to a tremendous synergy and a tremendous uptick in the use of, for example, CAR T cell therapy. I also think that the future yields well for Asian cell therapies. Asia already takes 20% of the clinical trials market share. And I think the future will be tremendously strong for Asia. In fact, there are more CAR T cell therapies in clinical trial in China than in the US. And Asia will really, the rest of Asia itself is really grabbing onto this. And you can see the enthusiasm that you feel throughout this meeting for the growth of Asia in cell therapies. However, cell therapies can be expensive because of the manufacturing costs and otherwise. But if you look at the cost effectiveness, because these are living therapies that last in the patient throughout his lifetime, actually, we've done some cost effectiveness studies and showed that it can be quite cost effective. But nevertheless, we want to reduce costs. And if we look at the example of penicillin, as the price went down with time, really global production and utilization went up with time. This is in the past. But I think the same will apply for cell therapy. As the price goes down in future, I think production and utilization and benefiting of patients will really go up. So what's the future of cell and gene therapy for tomorrow? That's what you're here in this conference for. So ladies and gentlemen, I present to you our faculty of speakers and welcome you in partnership with the International Society for Cell and Gene Therapy to the Singapore Cell and Gene Therapy Pan-Asia Summit 2024. Thank you.